Hi, my name's Dr. Keri Topouzian, and you're watching Ask Dr. T. Today's question is, what would I do if I had cancer? Well, it's not something that I like to think about, but considering it's the third leading cause of death in the United States, it's something that you should be prepared for. And really, to give this question justice, we'd probably need a couple hours. And so in the few minutes that we have, we're going to go over a few things. But just remember, this is the tip of the iceberg, some of the things that we're going to talk about. But starting out the list, what would I do if I had cancer? Top thing, number one, take a vacation. And, I'm not trying to be funny here. I'm being serious. I think one of the first things you should do if you find out something like this is you should take a vacation, get your thoughts together, decrease stress, and put together a game plan while you're on vacation on what you're going to do, who you're going to see, how you're going to go about getting treated, information that you're going to try to find out. And if you're able to, take a laptop with you, too, to just sit there and surf the web for information. After that, number two, we've got decrease your body's toxic load. Today, as compared to our grandparents or great-grandparents, the number of toxins in our environment are exponential compared to what they used to be. And the foods that we eat, the nutritional value and the antioxidants are much lower than it was back, 100 years ago. So we're in a situation here where we've got less protection and more toxins around that can trigger cancer. As far as detoxifying, there's several ways to detoxify. There's different nutrients you can take. For example, chlorella, which is a green algae, will actually bind toxins in your body and take them out. High fiber is also very good because, again, it will bind toxins and throw them out of your system. There's a lot of things you can do to detoxify, and that's very important. Also, just going straight organic, so you're decreasing the amount of toxic load that's in your food supply. Modulating your immune system or boosting your immune system. Again, several ways to do this. One easy way is to just go out into the sun, get some sunshine, which will make your body produce vitamin D, and then vitamin D basically boosts your immune system. Now, if you live in Michigan like we do and you've only got sun 3 months out of the year, basically what you do is you take it as a supplement, vitamin D3. Other things that I would take to boost my immune system are whey protein. And then there's several different herbs out there. One, for example, is called andrographis, which also boosts your immune system. But again, this is the tip of the iceberg, and there's a lot of different nutrients out there that you can take to boost your immune system. Another one I'll just mention is vitamin A. The next on the list, inflammation. With all diseases and with cancer, you're getting a certain amount of inflammation going on, and that's one thing that you would want to treat. Natural anti-inflammatories, which we've talked about in other segments, are turmeric, which is a spice, ginger, which is another spice, and also the fish oils, the cod liver oil, or the omega-3 fatty acids, which you can also take in the form called krill oil. Next is vitamin C to bowel tolerance. Now, what does that mean? Basically, you're taking vitamin C to the point, or just to the point, where you're starting to have loose stools or diarrhea. And for some people, that can be as much as 20 to 30 grams a day. Now, what's the point of this? Well, vitamin C has been shown to kill off cancer cells, so it's important to take a large amount of vitamin C. Linus Pauling, who lived to be 93 years old, was a proponent of vitamin C, and he himself took anywhere from 10 to 15 grams of vitamin C a day. And if you don't know who he was, Linus Pauling was I believe he was a 2-time Nobel Prize winner. Green tea extract. Now, the amount of green tea that you would have to drink would be somewhere in the range of 20 to 30 cups a day. So what I recommend for the most part is to take it as a supplement that you can get from your health food store. And green tea, there are dozens, if not hundreds of articles out there that show that it is useful in preventing and treating all different types of cancer. Now, I've listed 3 websites here that I feel that you should review and go to just to get some information on some different treatments for cancer. The first one's called Dose Naltrexone.org, but if you Google LDN, Larry David Nancy, the website will pop up. And what low-dose naltrexone is, it's actually a drug that came out on the market probably 10 or 15 years ago, and it was just called naltrexone. And it was used in heroin addicts because it would block the opiate receptors in the brain. And so heroin addicts, they couldn't get high if they're on this medication. But what they found was with using very small doses of this same medication, and when it was used at night, that it would slightly block the production of endorphins in your brain. And then the next day, you will have a reflex in endorphin levels that would be 3 to 4 times higher than normal. And what's the point of having endorphins? Well, they actually boost your immune system. They balance and boost your immune system, and they have been shown to be productive in stopping the growth of cancer. Again, check the website out. It's got some articles and some studies on there as well. The next site that I would suggest you go to is called the BurzynskiClinic.com. And Dr. Burzynski is a physician down in Texas that has developed his own type of cancer treatment. Non-toxic. Oh, by the way, just to go back on LDN or naltrexone, it's inexpensive and minimal side effects. But then going back to Dr. Burzynski, his invention or what he came up with is called anti-neoplastin therapy. Again, non-toxic, minimal side effects, and has also been shown been helpful for treating cancers. Again, I'd go to his website and I would educate yourself on if you think he might be able to help you or not. The last one is polymva.com, and again, this is a supplement that they've done studies on that shows that it has been useful in different types of cancer. Again, low side effects. Now, as far as chemotherapy, surgery, or radiation therapy, I'm not here to tell you one way or the other whether you should or should not do that. That's obviously your decision. And I'm just saying that what you should do is you should make an educated decision on what to do. Getting more than one consult from different physicians, and not necessarily just listening to your oncologist or a surgeon as far as what to do. Find out what your options are, get educated, learn what the different options are out there available. And with that, one thing I would suggest is that you consult a functional medicine physician. And go on the internet, Google functional medicine physician, and try to find one in your area. Just want to go through a couple other things that I feel are important regarding diet. Some key things to remember. 1/2 of all cancer patients die from malnutrition. So obviously your diet is very important. Cancer patients with higher nutritional status are more likely to fight off infections, okay? And patients with good nutritional status are able to better tolerate their therapies if they do end up doing chemotherapy and its side effects. So again, very important, what you're eating and the supplements that you're taking. Now, what a functional medicine physician would do, his approach for cancer treatment would be as follows. Supporting the immune system, which we sort of talked about a little bit. Inhibit tumor growth. Support normal cell differentiation. Well, what that means is that cancer cells don't mature. They don't differentiate what they're supposed to be. And there are ways to get those cells to differentiate or to mature so that they're not cancer cells anymore. Promote programmed cell death. The scientific term is apoptosis. To inhibit metastases or to inhibit the spread of the tumor. To inhibit formation of new blood vessels, which gives it its nutrients and its supply of energy, and to reduce the likelihood of recurrence or future mutations. Again, these are all different areas that a functional medicine physician would look at, and there are countless studies of different nutrients and supplements that actually act in these ways. Any questions out there? I know we went through this pretty quick. Tip of the iceberg. There's more information, but at least maybe this is somewhere where you can start to get more information. There's a question. Well, you can email me at askdrt@gmail.com, or you can go to our website at www.cfhll.com. I'm Dr. Keri Topouzian, and you're watching Ask Dr. T.